Okay, without any hesitation here, let's introduce our first person. Hessam Afshari is a Penn State University College of Medicine student. Actually, he's currently doing some work in emergency medicine, has a tremendous interest in emergency medicine, and he's going to talk to us about hospital-based methicillin-resistant Staphylococcus aureus screening and prevention, and how that provides numerous benefits to the community at large.
All right, thank you. I think the introduction speaks for itself, so I'll just get started. All right, the objectives of this talk is, I'd like to give you some background first about MRSA, or Methicillin-Resistant Staphylococcus aureus. Then we'll get into prevention and screening tactics, and I'll give you a short summary at the end. All right, so as I said, MRSA, which might be a familiar term, stands for Methicillin-Resistant Staphylococcus aureus, or staph for short. And MRSA can be given or transmitted by a bunch of different ways or venues. A lot of times, all of us carry staph, and a lot of people actually colonize in their nose or their skin. It doesn't cause any problems whatsoever. But staph can cause problems if it's able to, say, penetrate the skin or even get deeper in the body. You can get boils if it's able to infect a hair follicle, or even an osteomyelitis, which is a deep-seated bone infection, if it's able to get that deep. And when that happens, a lot of times, our body's defenses aren't able to cope with the bacteria, and we need other tactics to deal with it. But by and far, still, the most common route of transmission is human-to-human skin contact. So, I mentioned sometimes we need a little help treating this bacteria, and that's where antibiotics come into play. For minor skin infections, usually a topical ointment or even an oral antibiotic may be used. For abscesses, usually a surgical drainage is needed. And for serious infections, an IV antibiotic may be justified. But that's where the problem comes in. So Staphylococcus aureus, the generic bacteria, a lot of times this is susceptible to our bacteria, and in most cases, a group of antibiotics called beta-lactams are used. However, through the process of random mutations in the chromosomal genes, a resistance gene to the antibiotic is acquired. And then through the use of antibiotics, these bacteria which are resistant to the antibiotic are selected for. And these bacteria, the MRSA or the methicillin-resistant ones, typically now are being treated with vancomycin or an alternative. Interestingly, up until the 90s, MRSA was pretty much contained to the hospital setting. However, since the 90s, it's becoming more and more prevalent in the community, and that's what's alarming. To give you some statistics about the fact that this is actually happening, the CDC reported recently that in 2005, 14% of invasive MRSA infections were actually acquired outside of the healthcare setting. Of the remaining 86%, 2/3 of those were actually acquired outside the hospital, such as outpatient clinics, while 1/3 of those remaining 86% were acquired during hospitalization. These statistics support that community-acquired MRSA is becoming more and more prevalent, and thus it's a concern. This map here of the United States shows in different regions that the inpatient or IP and the outpatient contributions to invasive MRSA cases are almost equalized. And that's what's alarming and also warranting these prevention and screening strategies. At the bottom here, you can see that in 2005, there was nearly 95,000 cases of MRSA. 18,650 people lost their lives due to invasive MRSA infections acquired during hospital stays. So to get into the prevention strategies. So one of the most efficacious strategies to use in MRSA prevention is hand cleaning. And hand cleaning is not just hand washing with soap, but the alcohol-based hand sanitizers work just as well too. And you might see in hospitals they're becoming more and more prevalent. Another way that's under the caveat of prevention to decrease the prevalence of MRSA is to stop sharing as many items as is possible, such as razors, sheets, towels. Because while human-human contact, or even just rubbing skin with somebody, can transfer the bacteria if one person is infected, the bacteria can indirectly be transferred through, like I said, a towel or sheet, or even razors. And then contact precautions. Contact precautions mean if I have an infection which I think might be MRSA or is a questionable skin infection, or even if I know it's MRSA, bandaging it, keep it from being exposed, will help to prevent somebody else from coming in contact with it and acquiring this infection. The CDC recently produces their awareness, it's an awareness campaign. And you can see here, there's one example of, that's the contact precaution I was talking about. And right here, washing your hands frequently, showering after playing sports, and using a clean towel. That's talking to not sharing personal items, and keeping cuts and scrapes clean and covered with a bandage. Just talked about that. Additional prevention strategies. So sterile technique is an important one. If somebody's going to get a indwelling catheter placed, it's important the person placing it use a mask to prevent themselves from infecting the person or becoming infected. Also to clean the site of the insertion of the catheter or even a blood draw. And also to make sure that the conditions are sterile, meaning the application being inserted is sterile itself. Avoidance is pretty similar to contact precautions. It just means that sometimes you might be in a situation, like let's say contact sports, you're not sure you can actually cover adequately your infection. You might want to abstain from doing so to avoid implicating others. Testing is important too. If you have a questionable skin infection, you should go see a physician to get it tested, because not only is it going to get you treatment that's appropriate sooner, but the existence or the emergence of MRSA is due to improper antibiotic use. And to treat the infection with the right antibiotic prevents that cycle of giving an environment in which the antibiotic-resistant bacteria are now an advantage to survive. So screening techniques are the other balance, the prevention techniques. Screening techniques involve testing, evaluation, and isolation. Testing means if somebody comes to the hospital doing a nasal swab, test them for MRSA. Evaluation. You can do a culture, sometimes they take up to 48 hours, but there's also PCR testing or polymerase chain reaction, which can provide a result much faster. In hospitals, actually, I'm a medical student at the Penn State College of Medicine, and here, just recently, they implemented a new procedure where all the patients are going to be nasally swabbed and tested for MRSA upon discharge. And this helps to make sure the patients who are infected are isolated from the community at large. That's going to do a lot to prevent the proliferation of the disease in the community. And this one study here supports that these screening techniques do work. At a 26-bed ICU, that's an intensive care unit, at a university hospital with a high level of MRSA, nearly 4,000 patients were followed for 4 years. And screening and isolation techniques were used, along with contact precautions, which you talked about, being putting gloves on, putting a mask on, and keeping everything sterile. In this particular study, the acquired MRSA colonization dropped from 5.8% to 2.6%, and infected population dropped from 5.6 to 1.4. Nasal swabs, which we talked about for testing, they were able to identify MRSA in 84% of patients who had it. In another study, 2 hospitals in Charleston, South Carolina, and this was in an ICU and general ward targeted patients. Surveillance, which is the same thing as testing the patients and doing the nasal swab and then checking it out with a culture or PCR testing, and then isolating those patients that were infected. It was shown that for 1,000 patient days, the mean rate of nosocomial MRSA infections, or hospital-acquired MRSA infections, dropped from 0.76 to 0.54, 4.5 that is, and at the other hospital dropped from 0.73 to 0.57. And the surveillance techniques prevented 13 MRSA infections or bacteremias and 9 surgical site infections. This saved $1.5 billion. It sounds like a lot, but it takes a lot of money to treat these MRSA patients, because they have to stay in the hospital for days. They require pretty expensive antibiotics because they're so focused in their mechanism of action. So I told you just a short summary. So in summary, where are we going with this? So MRSA is no longer confined to the hospitals. We saw that on the map of the U.S., as well as in the statistics of where MRSA is being presented. So a broad-based awareness is what's required to deal with and curb the increasing prevalence of MRSA, especially in the community. Because in the community, it's not involving sterile technique. It's involving people not sharing their items, taking care of their skin wounds, being mindful of it. And so here at the bottom, you can see that it requires the entire community to take care of using antibiotics as prescribed, going to get them it.
Is there any, I noticed that you didn't have anything about antibacterial hand soaps. Is it known how much of an influence that the use of those has had in MRSA?
Yeah, so a lot of the, I guess we say the antibacterial hand soaps, like the ones that kind of like the Purell and stuff.
No,
What do you mean,
not
like the antibacterial ones?
antibacterial, that have antibiotics,
Yeah.
not the hand soap.
You know, if I'm not mistaken, they fall in the same caveat as washing your hands with just regular soap, so they would work in the prevention strategy. And from the antibacterial standpoint, I'm not sure that the antibacterials in them are what's actually killing the bacteria that will be in your hands. So washing them away, they would actually do good.
Actually, my question was, is it possible that antibacterial soaps contribute to the increased rate of MRSA mutations of strep into MRSA? Or
I don't think so, but I see your logic, and I'm not 100% sure. I think the antibiotic, I was just going to say one more thing. I think the antibiotic improper usage a lot of times involves using broad scope antibiotics with the beta-lactams. In short, the way they work is you have bacteria that are like a regular staph, it's not resistant. And if you use antibiotics too much, or you don't use them in completion, you use all of those and then leave those MRSA ones to replicate and take over now that the environment and the nutrients are all available for them. So, I'm not 100% sure. The logic is there, yeah.
I was thinking if you regular soap washes the bacteria off the hands, and if it has antibacterial in it, it's still being washed off, so it's not going to be selecting for MRSA or any other bacteria. Everything's going to be washed off with the water.
As I was saying too, like the act of actually cleaning with soap, it's more so the cleaning of it will be gone, but the antibacterial nature, you're right, then it doesn't leave anything in that environment to take it over. Yeah. Yeah. Yes. Or we'll go over there. Why not?
What is the major reasons that you see MRSA in the communities versus in the hospitals? I don't know if you can discuss that, but what are the major reasons that it's getting outside of the clinic?
So a lot of reasons why so you're asking what is really causing it to expand the community. The hospital setting has been aware for a while now. Like I said, from 1950s to 60s when antibiotics became used, in the hospital setting, that's when MRSA began to emerge in the hospital setting. So in the hospital setting, with these screening techniques, they've been used in the ICUs for a while now because of the implication if it's not taken care of. But in the community, they say a couple of reasons, like more crowded living conditions, just in general, the overuse of antibiotics in the community. In the hospitals, you know, the IVs, a lot of times it's done for you properly, but people take it home and they save a little bit for the next time. And that isn't the right antibiotic use for the right, you know, infection. And so improper antibiotic usage is huge, as well as the crowded living conditions are just two contributors. I think you had a question.
I saw with the CDC brochure, it was targeted towards young athletes. So as we studied, there's a high amount of young children getting involved in athletes or in school settings that communal living. So I think that there's a higher rate in college communities.
So in the school setting, one thing they have found is that especially in the athletes in the school sports setting, there's a lot of interaction and a lot of contact, and that is contributing to the spread of MRSA. Like, you know, that's exactly why it is targeted to that one, because that's the population that needs to take extra precautions to cover their bandages, not share the towels, and also just in general, you know, be mindful of the fact that the contact can happen. So in the school setting, there's a lot of crowded conditions in a way, and a lot of the contact is happening, especially in sports. So the awareness campaign is targeted towards the schools in that regard.
We have time for one more question.
Yes.
With antibiotics in the water supply, they found that they have trace antibiotics in the water supply. Would that affect the MSI?
I didn't really read about that in specifically, like the antibiotics in the water causing. You're saying they found antibiotics in the water.
I've heard it on the radio. They found trace elements of antibiotics that you dump in, you know, down the toilet and all of that. Does that affect everybody? You know, does it affect MRSA? Affect this at all?
I didn't read about it in particular.
The concentrations were pretty trace. Yeah. So the concentration wouldn't have been high enough to
Yeah, I would
contribute
imagine,
to antibiotic.
I imagine the concentrations there, like you were saying, would be higher, but, you know, that's all I can guess. That's my best guess.
Great, thank you.